Hey all, this is Kamir, and I have Akhil and Rahul with me. We're from Inspira Advantage. Going to give a few more minutes for folks to join, but just as we kind of get prepared for it, would love for you guys to kind of, just go through some of the housekeeping stuff, and then let's start in the next few minutes. Cool, guys. We'll kick it off. Hey, everyone. This is Kamir. I'm one of the co-founders of Inspira Advantage, and we are a med school admissions consulting and an MCAT prep firm with the idea of kind of helping candidates with their med school application process. I have with me Akhil, who is basically a third-year student at Lewis Cat School of Medicine, and then Rahul, who is doing a second-year internal medicine residency at UPenn. Would let them give a quick intro before we kind of dive into some of the content that we have for you all today. Rahul, Akhil, if any one of you guys want to kick it off.
Sure, I can start. Hi, everyone. My name is Rahul. Thanks, Kamir, for the introduction. So I am a second-year internal medicine resident at UPenn, as Kamir had mentioned. I went through undergraduate at WashU in St. Louis. I'm originally from Chicago and spent most of my time in the Midwest prior to coming out here. I went to medical school at the University of Illinois and stayed in Chicago to do additional research at Northwestern, which ended up leading me to University of Pennsylvania for the physician scientist track, which is basically a sort of residency fellowship track for people who are planning on doing both clinical as well as lab-based research careers. And so actually in about 5 weeks or so, I'll be staying on at Penn to start my fellowship in hematology oncology. But yeah, looking forward to meeting everyone today and answering some questions, and hopefully we can, as it says, demystify the med school application process a little bit for you.
Hey everyone, my name is Akhil. So as Kamir mentioned, I'm a current student at Lewis Cat School of Medicine at Temple University in Philadelphia. So I'm originally from the Philadelphia area, went to high school around here. For college, I went to Northwestern and majored in biological sciences and economics, and then decided to kind of come back home for med school. I took a year off last year to do orthopedic research at Massachusetts General Hospital in Boston, and hoping to go into orthopedics for residency. So that's just a little bit about myself, and yeah, very excited, like Rahul mentioned, just to meet you all, and hopefully, yeah, we can help you guys out a little bit and provide some guidance for this tricky process.
Cool. Awesome. Thanks, Rahul. Thanks, Akhil. So guys, before we kick it off, appreciate everyone to be on mute. We would love to, we'll be spending a lot of time kind of answering Q&A, as the whole idea is to kind of demystify some of the questions that you guys have. So feel free to start putting your questions in the chat box. I'll be picking it up and kind of asking Rahul and Akhil on that. So we'll be kind of talking through that. In terms of questions, there is no a dumb question or a smart question. Whatever is on top of your mind, just put it out there. We'll be kind of sharing it and talking about it across the board. Post this webinar, Ryan from BMES, she will be kind of sending across just the whole presentation, as well as kind of the recording, along with some of the information about us. So you guys can definitely feel free to follow up back with us. But want to use and kind of spend most of the time talking about the med school application process as much as we can, and also touch a bit about the MCAT too. So with that, just a quick intro on who we are and why we're kind of doing this right now. So as I mentioned, as a med school admissions consulting firm and MCAT prep company, over the last 9 years, we've been supporting candidates like you with the application process, maybe kind of, cracking MCAT, maybe kind of building the personal statements in primary application, or customizing secondary applications to schools. But the idea is over the last 5 to 6 years, we have seen a massive drop in the acceptance rate at med school. Just to talk about stats, 2016, the acceptance rates in med schools were around 54. Right now, we're looking at 38. So with increased competition, there's increased focus on how to differentiate, how to kind of, bring up those elements of your profile that kind of matches to what AdCom is looking for. And our idea and our process and our programs are focused in kind of, helping candidates kind of craft applications in that manner. So Akhil and Rahul are two of our leading admissions consultants, come with extensive years of kind of evaluating, I would say, multiple applicants across the board, and most importantly, guiding them to kind of, achieve their dream med school acceptances. With that, I think one of the kind of common questions that we often get asked is like, whom do we usually work with? And a lot of our candidates that kind of, we support are first-time applicants who are either coming as junior seniors from college or kind of our first-time applicants coming from gap year. And then almost 25% of our applicants are reapplicants, considering 60% of applicants every year get dinged. A lot of folks end up reapplying every year. So that's kind of how we look at our practice and support on that front. But with that, would love to kind of, start diving into what we kind of, over the last 8-9 years, having supported thousands of candidates, love to kind of, share with you some of the high level stuff at what we see a good application and kind of what differentiates a matriculant with someone as a general applicant. So Rahul, if you want to kick this off, we'd love to kind of take it from there. And for the audience, please start dropping in questions in the chat box. We'll be kind of, hitting the Q&A section after this.
Yeah, thanks so much, Kamir. So, when people are applying to medical school, and this actually applies to a lot of graduate schools in general, but, historically, medical school applications in the whole field of medicine has been something that's been very traditional in a lot of its practices and kind of been difficult to change over the years. But that said, over the last few years, there has been some change in sort of what they're focusing on in terms of looking at applicants, just going away from just pure academic success and this whole picture of an applicant as someone who could thrive in medicine. And one of the things that I remember learning very early on when I was applying to medical school is that it's very important to have a clear reason to apply. The honest answer is that there's a lot of jobs where people can make more money more quickly than in medicine, and it requires a lot of dedication and persistence. And so it's really good to have clear motivations and a clear drive for entering the field. And it's, in terms of your story. And that kind of leads into the second point, in which academic success has always been sort of the backbone of entering medical school. But more and more, it's not the sole gatekeeper. People still, people meaning admissions committees, still use it as a major screening tool, especially because, there's so many more and more applications. But the way to really stand out, especially when there's such a wide variety of resources available to people studying for the MCAT and undergrad courses, is to really have a clearly delineated story. And especially if you can have some sort of passion or drive within the field, rather than just saying, I want to be a doctor just for the sake of it. You can have some idea of your life story and what that wants to make you do in the field of medicine, then that's going to make you a much stronger candidate with a much clearer motivation and drive that admissions committees can fall back on. And probably the most important part for myself, at least, has been the identification of mentors throughout the process. And in part, that's what we want to provide, is some mentorship, as people have kind of gone through these steps before and had success, as well as, we've been able to look to our peers and what have made them successful and kind of bring that back to you guys. But also faculty mentors, other friends and family who have kind of gone through the field. Anytime you can have that sort of person who is, one, willing to stand up and bat for you when you're looking at certain places. Number two, someone who can provide honest feedback and not just tell you what you want to hear. And three, help you make tough decisions, in the fortunate case that you're able to decide between certain medical schools, figure out how to leverage that. And then lastly, there's no substitute for organization, diligence, and persistence. There's everyone, or at least many people applying to medical school are going to be really smart, very talented in their own respects. But there's no substitute for hard work and really putting in that time. The earlier you can, the better, but really putting in that time to devote yourself to your application and is why you want to be a doctor and what you're going to do with that. That is going to really ring echoes to them and make you a much stronger candidate when applying to medical school.
That's great, Rahul. Akhil, would you like to add anything, chime on this?
I think that was really well said. I will say that the biggest thing, I think, out of all these factors kind of comes down to what Rahul was mentioning about mentorship. Just because nowadays there's just so many applicants, it's easy to kind of get lost in the process. But by having people who you can constantly turn to, who have been through the process, know what it's like to apply, know what it's like to have multiple acceptances under their belt, and can kind of read your application and give you a personalized assessment of what your strengths and weaknesses are, that's truly invaluable. Because especially, like I mentioned, because there's so many applicants, your pre-medical advisor, is not going to necessarily have all the time in the world to look at your application specifically. So whether to have those mentors, whether those be peers, whether those be admissions consultants, things like that, that can play a large role in this process, especially nowadays.
Absolutely. I think one like just as we speak with a lot of candidates, and I think with the primary applications coming up this month, one of the common questions that we get asked is like, what is the process that we kind of run through just with our candidates, or how we kind of work with, because it's a multi-month, multi-fold process, starting with kind of selecting your schools, thinking about your primaries, then getting into your secondaries and interviews. So I think the way we have gone about it, and just more about thinking about like what is work for candidates and not, and again for you all could be a great framework to think about, is taking a step back rather than thinking of let me start drafting my personal statement, or let me start putting my 5-7 work activity entries out here. It's more about like thinking through like, okay, who you are as a candidate, what your life story has kind of shaped up, how have you kind of driven that into an impactful experience, and how has that driven towards why medicine and why now. Because a lot of times the application in itself is a reflection of your achievements, is a reflection of your goals, and also about your realization, rather than just mentioning about like, this is what I've done, and that is something that I'm trying to do. So we often kind of differentiate, and especially with a lot of reapplicants, we get to see the last year's applicants, and we know it didn't work. I think a lot of commonality that kind of goes among those pool of candidates is that I think a lot of them use, I would say, a telling framework rather than a showing framework. And like a telling framework is more about like, yeah, I was a vice president at BMES, or I was kind of, volunteer at GlobeMed. That's awesome. But then so what? Like, how does that differentiate you from someone else who has also did something very similar? So I think the way we suggest is often going with a showing framework, which is like, this is what I did. This is the impact that I've left. These are the skills that I've gained. This is what I want to do next. And this is my body of work. And now when you replicate that across maybe work activity, maybe primary, maybe secondary, you start showing to the admissions committee how impactful, how meaningful, and how kind of thoughtful you have been through the whole process, and guiding them as an adcom, saying, okay, this is why I see myself at that school. Because like Rahul mentioned, it's a very privileged position to kind of choose between a couple of med schools to be in. But the idea that most of the med schools get so many applications, they're looking to understand that what research have you done, what kind of understanding you have, not only towards medicine, but even to that particular school, and why your work experiences matter and match to that. So I think ability to bring that together is super crucial. And at least when we see some of those successful candidate applications every year that we kind of work with, those have been a commonality or a factor that has kind of, stayed with most of those successful candidates. So just as a framework to think about, but before you start jumping into writing something and all, have a framework, have a storyboarding with you, which can guide you through those experiences, and then pick those which really are needle movers, rather than just an average one, just because for the sake of doing it, you did that. But I think that's kind of 2 cents from my side. Akhil, Rao, if I missed anything that you may want to add on that.
No, I think that was perfect. And yeah, I mean, again, I think that Kamir nailed down a very important point, which is just starting off with a clear framework is going to help everything else in the application process move a little more quickly as well. You have no idea like how many people, I've gone through their personal statements and probably like 15 drafts before we find something that you finally nail down. But if you have a very clear story of, what your next steps are. And I think one of the things, in addition to like kind of explaining your body of work, the real thing that admissions committees want to see is what are you going to be able to contribute to their community? And if you can show that, in your personal statement and your activities list, then it's going to make you a much, much stronger candidate. But yeah, I think that everything else was completely nailed down. So.
Awesome. Yeah, great. I think so. With that, would love to start kind of diving into some of the, I would say, this Q&A that we have, and love to kind of talk about that. I know Albert kind of put up a question out there, so we can take it from there. But for everyone else on the webinar, please feel free to start dropping in your questions, and I'll take it from here. I'll stop screen sharing just that it's easy to pick it up. Cool. So I think this is for both of you, Rahul and Akhil. So the question is, I'm doing a co-op at Biogen as an analytical development intern. Since I'm planning on applying to med school, I have been hesitant to accept the position. It would set me behind a year. I wasn't sure how helpful it would be to med school. I wanted to do the internship because I wanted to work in the industry before I go into med school. Will this look bad to the committee? And will this look like I'm not fully invested in medicine?
I can. Oh, sorry, Rahul, you want to go ahead? Or yeah. So I think this ties kind of into gap years in general, right? So that aren't necessarily medicine focused. So I don't think that that's an issue at all, as long as you're able to effectively communicate to admissions counselors, to medical schools that you're applying to, the motivations behind that. If you're able to say that, I definitely want to pursue medical school, but I wanted to pursue this additional interest before my medical training, and express that in a very eloquent and comprehensive way, I don't think any medical school admissions counselor is going to look down upon that. I think they're going to actually admire that, just because you were mature enough to kind of realize where your interests lie and say that I want to do this before I dedicate, the rest of my life to medical training. So I don't think that it can hurt you, as long as you kind of word it correctly in your personal statement and your other materials.
Yeah, completely agree. I mean, yeah, it shows that you've taken the thought to really figure out what you want to be doing before you commit to the 4 years of medical school. And, my personal experience, I was accepted into medical school and still deferred my first year to start working on my research project. And one of my colleagues and closest friends from medical school, he had done his MBA and worked in industry for 3-4 years before applying to medical school. And, we both had sort of these circuitous routes that, before we started medical school, but in the end, doing something like that, it's a really cool opportunity to meet people sort of on the periphery of the field of medicine. And again, that's one of those things that can really paint your picture. And although a lot of medical schools, maybe you don't want to say like, I plan on doing medical school and going straight into industry. The reality is a lot of medical schools, Stanford, for example, about 10% or so of their medical school graduates do go directly into industry. And having those kinds of experiences, especially if it's something that you want to do in addition to your clinical medicine, I think it can be a very strong part of your application. As Akhil said, if you can really bring it into how this is going to make you a stronger medical school candidate and gives you some direction in your career thereafter.
Awesome. Great. Second question, we have a very good question from Edith. I would love to pursue an MD, PhD. However, I have been part of a lab for the last 3 years. So I'm not sure if not having experience in more labs would affect me. I'm a rising senior, so I don't qualify for summer research programs. Would you see this affecting my possibilities to get into a med school program?
So, as I mentioned, I deferred my first year to work in research, and I was sort of one of these people that they call like a late bloomer for sort of these research tracks. And I internally applied to transfer into the MD PhD program, but I was at a different institution at Northwestern for my research project. And so just took off additional time. That said, I only worked in one lab throughout most of undergraduate, and always, even when you're in medical school and applying to residency, and when you're an undergrad applying to medical school, the strength of your research experience is going to play a lot more into the picture than how many research experiences you've had. If you have a mentor who is willing to write a strong letter of recommendation, and even for undergraduates, it's not expected that you have publications, but if you at least have shown that you've been able to create a body of work and present the work and can have someone who can vouch for your skill in the lab, that should suffice for, obviously in addition to everything else from medical school application, but to really drive you into an MD PhD program. So I wouldn't really worry about, having not done work in several labs. If you think that you've had a strong experience, then that should suffice.
Akhil, you have anything to add?
Yeah, just a quick thing going off of that. So I think a lot of students think that, they need to have a profound experience in a research lab for them to put it on their resume or their med school application. But just honestly speaking from personal experience, I had a not so great experience in my biochemistry lab in undergraduate. Realized that I really didn't enjoy it. However, that became one of the best parts of my medical school application, because I was able to say, I tried this and running these assays and these gels just wasn't for me, but this is what I learned from it. And that's what they're looking for at the end of the day. They're not necessarily looking for you to have, like Rahul said, a list of publications or some things like that at the undergraduate level. They're looking to see the experiences that you did have and what did you get from that? What did you learn from that? Even if it didn't result in something necessarily quote unquote concrete, as long as you're able to say the benefits and kind of the drawbacks from that experience, I think that's what they're, that's a net positive that you can kind of get from an experience like that.
I think that's a really good point. And just piggybacking on that, one of the, this is very common among many of our, students and the clients that we work with every year. One common framework that we often use is, why is AdCom, asking for this? And if you take it from the first principles point of view, med school is a long journey. It's a 12 to 13, 14 year commitment that you're kind of putting yourself. And the test is of resilience. The test is of kind of curiosity to learn and to kind of leave an impact. Like that's basically the idea of being a doctor, right? If it's in a very simple nutshell. So whenever you kind of going through your research experience and when you kind of outlining that through your application, you want to come across as someone who used this experience to kind of bring out those traits, like the ability to kind of, learn, fail, try again, iterate, which is what a lot of research is about. The ability to kind of bring an impact out, maybe a presentation, maybe a kind of panel work that you did or a paper, or kind of, showing that as a platform for you to double down. And when you go into med school, I want to kind of, use that as a platform to kind of learn further or do more research. So I think the quantity matters less, the quality matters a lot, because at the end of the day, those two nuances of the stories that you're going to bring out, those are going to kind of build the base for how you're going to do it. So it doesn't matter you went to 10 labs or 6 labs, but you went to one lab and you did something really impactful and powerful. That's your mojo. That's what you want to kind of build upon. So I mean, again, agreeing completely to what Akhil and Rahul said, focus on things that you did well. That matters more than the quantity itself. Sorry, this went a bit long. A bunch of questions coming in, so I'll kind of go to the next one. Does pursuing masters help an applicant who will graduate undergraduate with a GPA with a 3.3 to 3.4? I think the other way to answer is like, should I basically get a master's to bump up my GPA?
So, a lower GPA, again, isn't the end all be all for application to medical school, but it is an important screening point. And if you have the ability to take a post-bac or master's course and really can show that, you've had sort of growth, and there's always personal things that come up that can always lead to lower GPAs in college, and medical schools understand that. And so if you can kind of show that, you've done the second step of courses and had improvement in your GPA, then that's really, really good. I mean, it's kind of the same thing that if someone had not so great GPA in their freshman year of college, but they can see a stepwise improvement every year, that also bodes very well for medical school applicants. So, I wouldn't necessarily do it just for the sole reason of bumping a GPA, but if that's an added benefit in addition to the coursework that you learn and potentially getting to know some of the department if you're applying to that school as well, then those are definitely great reasons to apply to a master's program. And then, of course, if it can improve your GPA, that's an added benefit.
And just to piggyback off of that, I would say if you're looking at post-bac programs in particular, I would definitely do a little bit more research into those, just because there are a vast array of those programs. Some programs, if offered acceptance, actually give you conditional acceptance to medical schools. Some give you a guaranteed interview to that medical school, and some don't have any guarantees with those. So, you know, when you're dedicating a year of your life or a year or two of your life to doing a post-bac program, make sure you know what you're getting out of that program, because, you know, you're investing in them, but they're also investing in you. And you need to make sure that you're kind of spending that year or two in a right way. And if you can look at a program that guarantees you an acceptance or an interview, I think that kind of gives you a little bit more of an advantage compared to some other programs that don't necessarily have some of those guarantees. But I think that applies more so for just post-bac programs as opposed to all masters in general.
Cool. Awesome. Thank you, guys. We have a good question from Ivana. I'm a student athlete at a Division I school. Practice and tournaments take up most of my time. I do have other research and volunteering projects. However, do med schools understand the gravity of being a student athlete, or do they think it's just a one line in the application? This is a really good question.
That's an incredible question. And I would say definitely not. They would not look down on that. As in contrary, they would actually look really positively upon that. I think participation in athletics, especially at the collegiate level, at D1, D2, or D3 institutions, it shows a level of dedication that you can't necessarily get from other activities. And that travels not only through medical school, but also into residency as well. There's studies that have shown that, you know, other than GPA, when looking at residency admissions, you know, D1 applicants are actually, you know, those most favored to match. So it's actually something that will play really well into your favor, as long as you can kind of get some of those other experiences. Now, you may have less volunteering, less research, less clinical experiences than some of your medical school peers who are also applying. However, that's fine, just because you just need to kind of vocalize that well and communicate that well to medical schools, that, you know, a lot of your time was taken up by practice and tournaments and et cetera. But I think it's more of a strength than a weakness of anything.
Yeah, you know, it may have changed, but when I was for my medical school, like a student reviewer on our like medical school application review board, one of the things that was sort of like in the positive screening category was being a student athlete. And exactly as Akhil said, it's one of those, you can't really teach that kind of dedication and hard work, and it'll go a long way, and they definitely understand that. So yeah, I don't really have too much else to add. It's definitely a strength to the application.
I think just looking at the last year cycle that went by, we ended up supporting, like, as much as I can remember, 15 to 20 D1 kind of, you know, athletic candidates across the board, and seeing acceptances across like varied school like UPenn and Harvard and UC Davis and other kind of places. And I think one thing that stood out, and which is pretty common across most of those athlete candidates that we supported in the last cycle, was they brought a lot of like their learnings through their examples of the sports. And that's a very big differentiator. So even if you go on like Howard Medical School's website, and just to take an example of that med school, but that's common across most of the med schools now, there is this huge focus on diversity. And that comes from variety of folks, non-traditional applicants, athletes, kind of, you know, folks who have kind of spent like a lot of study abroad or volunteering and clinical in Cuba or kind of Costa Rica, kind of varied kind of experiences. And the reason is that the stories that you're kind of bringing out and you're connecting that to medicine, that's a very unique angle to look at medicine than a conventional route. And this is not a dig into a conventional route, but it is just that when you have something different, you want to piggyback on that, you want to double down on that, because that's where you differentiate from 59,000 others who are kind of taking a different route. So definitely, it's not a one-line thing, but it's also about how smart you are in kind of using that as an opportunity to bring out your skill, bring out your character, and bring out like more about the ability to talk about med school. That's equally important. Just mentioning that, hey, I played polo or I kind of was part of the swimming team or tennis team doesn't count. So I think ability to frame a story, ability to position yourself is equally important on that front. With that, moving to the next one, I think we have a question saying, what if the gap year isn't related to anything science related? I'm planning on attending an Islamic institute to learn classical Arabic during my gap year, where I plan also to do clinical volunteering on the side.
Yeah, that's an excellent question. I think an important one, because oftentimes we get so bogged down in like, you know, gap years and these experiences related to research or shadowing or clinical work. And there are plenty of people who take gap years to do things, you know, totally unrelated to that. It's a little bit of a, it's a little bit of a give or take because, doing something totally outside of the field of medicine in a way can be looked at as a little bit of sort of deviation from the norm, which is fine as long as you have some way to bring that back. And one of the points that Kamir just brought up is they really do look for sort of a whole plethora of definitions of diversity. And that includes diversity of experiences. And if it's something where you're able to show that this impacts your ability to, interact with others. And, I double majored in biology and Spanish literature. And so a lot of my thesis actually in undergraduate was related to etymology of medieval Spanish literature. And that was something that admissions committees wanted to ask me more about during interviews than my research, even though I was applying for research tracks. So I think having that kind of diversity of experiences is fine as long as you have some way that you can talk about how it impacts your ability to be a doctor. And I think especially, doing things like classical literature or language, one of the things you can always bring into is it impacts your ability to really have a stronger foundation in sort of the humanism of medicine, which especially in today's day and age is such an important part of being a doctor. It's not just being able to understand science and biology and medications.
I think just to quickly add on that, we have a candidate currently whom we are working with, and again, she has been kind of focusing on Spanish language as kind of her master's and all. And she brought a very interesting nuance as we were kind of, thinking about how to position the personal statement. And it came across that if you look at overall, population of kind of patients over the last 7 to 10 years across America and across different kind of, health systems, you see that the language is often becoming a barrier for a lot of first care delivery. And that's why kind of there are other huge role of translators being played, doctors kind of doing language programs and things like that. And just a small nuance to bring about. But when you think about patient care and you're able to kind of bring a different cultural nuance, maybe language, maybe culture, maybe something else, that just adds a point of view that, okay, you know what, I'm thinking of more of a global holistic way of kind of, adding and helping the community. And this part of my experience is going to help me do that. So I think of a way to kind of position that in an advantageous manner. But again, to Raul's point, diversity counts and its ability to kind of connect that dots to why med school. Taking that to the next one, is shadowing required or important if I'm earning clinical hours through working as an EMT?
So you definitely have a lot of experience from the EMTs, from the EMT experience with regards to clinical times and things like that. I would say, however, that shadowing in a clinical setting, whether that be a hospital or clinic, like an outpatient clinic, I still think that does provide a unique perspective because as a former EMT, a lot of the stuff that you do is out on the field and your point of care stops as soon as you reach the ER, right? So you don't necessarily get to experience what a doctor goes through in terms of working with patients, working with difficult diagnoses, et cetera, et cetera. So I do think that needs to be supplemented with some traditional clinical shadowing or OR shadowing or just general inpatient shadowing if possible. However, it definitely does play into your benefit that you are an EMT because of course that provides some of the best clinical exposure you can get as an undergraduate.
Yeah, and applicants I've worked with in the past, and I mean, I think being an EMT is an excellent learning opportunity and sort of a good entry and sort of into the field of clinical medicine. But kind of as Akhil said, one of the important things is then a good way to position it is sort of that was your entry into sort of your interest in medicine, and then having that extra direct clinical shadowing with physicians was really what cemented that decision and really learning the lifestyle and the nuances that go into being a physician. But I mean, certainly that can all kind of be along a spectrum, and being an EMT is definitely a great entry point for that.
That's great. Cool. Moving on. The next question is, because of COVID, most hospitals and doctors had to close down all shadowing opportunities for over a year. Will med schools still expect a high number of shadowing hours? And I'm assuming this is for this application cycle.
Yeah, that's a great question. I think something that's impacted a lot of people. Medical schools and I mean, even residency programs for medical students who are applying to residency have really taken this into account, because they understand that there's been a lot of restrictions related to COVID that's limited people's ability to get shadowing. So, I think they, at least, through one of my current applicants that I'm working with, like this has kind of impacted him. And I think one of the things that he did, which was very flexible and creative, was he worked out like sort of virtual shadowing in clinics, which I think was a really great experience for him. And honestly, even for me, probably now like 25%, but in the spring, probably like 80% of my like outpatient time was doing telemedicine visits. So that is kind of a realistic experience, and probably something that's here to stay. So that's always a great opportunity, I think, that people are taking advantage of nowadays, that if you want some more shadowing experiences, try to figure out if there's some sort of virtual capacity to do so. But, if it's something that you had a previous shadowing experience and it was cut short, medical school admissions will be taking that into with a grain of salt, understanding that it's just one of the realities, unfortunately, of this application cycle.
I think just to add to Rahul, and this is a very ongoing discussion even within Inspira, because along with Akhil and Rahul, many of our other kind of consultants are also current and former AdCom members. And when we kind of ask them, like, hey, how is this cycle kind of coming up or shaping up different than the last one? I think one common response around COVID that we have got, and this is also most of the schools are adding another prompt in secondaries this year around COVID too. So adcoms are really looking into how did you lean into this situation, right? So this is not an economic pandemic or a real estate pandemic of 2008, 2009. This is a healthcare pandemic. So when you, as a future healthcare leader, are kind of, putting in your application, this is your time to kind of show that, what, the world got affected. We had like a crazy number of infections, crazy number of deaths, like countries and communities have been destroyed. This is what I did in my little way I could. It could be a volunteer on a drive-through clinic. It could be distribution vaccine. It could be calling up folks. It could be something else. There's nothing too small. There's nothing too big. But sitting on the couch does not count, especially when the acceptance rate is 36%, right? Like either you up your game or you don't play the game. But like and the way we are kind of advising our kind of clients and students is more about like bringing in those nuances, bringing in those experiences that yes, shadowing may not have worked. Okay, how did you then use your time in some other places? How did that experience kind of help you leaning in? But this year, this application cycle, as you kind of plan on applying, as you kind of plan on framing a story, don't miss the COVID thing. This has affected everyone across the world. Not leaning in shows a big, like, I would say, apathy towards like what the world is being affected. So as I would suggest, if not shadowing, something else, but something around the COVID situation, bring it on, because adcoms are looking to kind of read that.
Yeah. Relatively speaking, this has kind of brought up two things that are commonly asked during the application cycles, but I think in a way, one of the few positives of the COVID pandemic for those applying to medicine is, this is an opportunity to really have some introspection and try to see what is your motivation for entering the field of medicine. And this pandemic has really, I think, given a lot of people clarity on that sort of answer. And then the other thing, as Kamir said, is it really just would be a great opportunity to demonstrate some of your ingenuity into finding ways to experience and give back to the community, because there's so many unmet needs that people can help out with during the pandemic. And so it's something that would be viewed very, very, very favorably if you were able to find opportunities to sort of help out in any way possible during the pandemic.
Great. Moving on to the next one. Does it look better to shadow only a doctor or two, or is it okay to shadow multiple? I currently work in an ER, but I'm looking into shadowing multiple specialties that I'm interested in. I wasn't sure if it looked better to focus on one type as compared to multiple.
So yeah, I can tackle that. I think that's a great question, and I think that the biggest thing I do recommend to my students is continuity is very important, right? For multiple reasons. One, continuity shows adcoms that you're able to stick with something and endure through it for several months, periods of time. It also helps you develop a relationship with the physician or nurse practitioner or whoever whom you're working with. And that can benefit you in a number of ways. That kind of ties back to what we were discussing with advocates, having mentors who can kind of like counsel you throughout this process, right? So having someone in the healthcare field to do that is truly invaluable. And yeah, it just, I would recommend doing that as opposed to trying to do, like 5 different shadowing experiences and just meeting once or twice with those providers. I'd recommend, reconciling those into 1 or 2 really strong experiences that you can talk at length about during your, in your application and during interviews as well.
Yeah, and one of the other, great benefits about continuity is that it really gives you probably more profound patient experiences. And that's something that is really, really helpful to talk about, whether it's in the personal statement or interviews. And, those are kind of the things that are the real drives for why we enter the field of medicine. And, having that sort of longitudinal experience with a provider and seeing how they interact with patients and having that, more experiences with certain populations of patients can really give you a lot more insight into that you'll be able to talk more in depth during interviews. It's with most things in the application process where quality trumps quantity at any point, whether it's multiple research opportunities, whether it's multiple different shadowing things, having 1 or 2 really, really strong experiences is going to go a much longer way because that's something you're going to be able to talk more in depth about. And yeah, I mean, that's definitely something that admissions committees will look at more favorably rather than just sort of like stacking the sections in the application.
Oh, awesome. I think we have 2 related questions, so I'm going to combine them into one. I've always wondered how candidates answer the question, why do you want to become a doctor? For me, it's because I think being a doctor, at least from the clinical point of view, is the one career that allows you to directly help others. However, I feel like this answer is too generic or cliche. What are your reasons for becoming a doctor? The second question is, how has Inspira Advantage worked with candidates to kind of create a differentiated story so that it does not come across as my peer story, which many of the applications share? I'll take a first dig at it, and then Rahul, Akhil, if you kind of want to chime in on this one. So I think the approach of kind of thinking about like why med school, why now, as well as kind of thinking about differentiating goes hand in hand. So the way we go about it, or kind of when we start working on anyone like of our students' applications, is to break down their life into like 5 phases: their childhood days, their high school days, their college academic experiences, their college non-academic experiences, and then kind of, what is their future goal? So like in 10, 15 years, what is their mission? What is their vision? So like, digging into each, it's like, for us, it's more about the curiosity of learning about that person's experience. Like, who were they? Where were they born? What were their initial conversations like when they were growing up? Do their parents come from like a family of doctors or not? Are they coming sometimes from an immigrant background or not? Because the reason is a lot of the achievements, a lot of basically I would say our credentials are not absolute. They're relative to the situation and the circumstances that you have overcome to come to the place where you are right now. So when we talk about work activities, when we talk about achievements, it's not like, oh, I was the president of this club, but wait, I came from a very different background. I had no idea of this. And then we kind of, come out here. And the case in point is we support a student organization, which is for Orthodox Jewish women members. And for that kind of organization, it was the whole idea is like getting a higher education was not too much encouraged in that kind of section of society. And now when they are framing their story, a lot of that context comes into the picture, and then framing their shadowing, then framing their research experience adds so much more value because they are not surrounded by those same resources as someone else would be. So I think beginning from there, getting into the high school days, getting an understanding of what triggered you towards biology, what triggered you towards pre-med, and kind of, maybe frog dissection experiment, maybe student lab manager, whatever that looks like. And then connecting your academics and non-academics together to frame a clear goal. That's how we kind of go about approaching anyone's application. And that's when for us, what we call is like a persona doc. It's like when we kind of create that, which is, okay, this is what the candidate is in terms of strengths, weaknesses, places of resilience, things that didn't work. And that builds the framework to then start looking at the personal statement, creating an outline, or maybe the aha moment, that first foray into medicine, why med school, why now, and the trigger impact. And that's where you go about. So the question is not about like, why do you want to go to med school? Of course, you want to go to med school to become a doctor. Why do you want to go to nursing school? You become a nurse. You don't become something else out of that. But it's less about the outcome in direct way. It's more about the journey that you want to see, impact where you want to see, and why do you want to see that? And why are you the right person? Why not someone else? So I think the differentiation and answering that personal statement goes hand in hand. And that's how we kind of think about it. But again, that's from one point of view. Would love Rahul and Akhil to chime in as AdCom members.
Yeah, so to kind of go off of that, when I work with my students, I tell them, there's no one right story. There's no one right motivation. Everyone's story is different. And that's what we kind of do in our process. So that's why we kind of start out working with students, just having 4 to 5, 30-minute phone calls just about their life to figure out what their motivations were, to figure out what their personal experiences were, like Kamar mentioned. And to kind of figure out those motivations, because until you lay out everything about high school, college, etc., out on the table, it's sometimes very difficult to see where your motivation is, because like most candidates, including myself, did not have a epiphany moment. There was no aha moment where like, okay, now I'm going to apply to med school. When you really break it down, it's a result of all of these little decisions along the way, which you're only able to kind of uncover once you break down your personal story. And that's how we kind of go about writing the personal statement and things like that. So long story short, there's no one right answer. Everyone's story is a little bit different in their own unique way. And it's all about finding what those intrinsic motivations were along the way to kind of make this monumental decision of applying into medical school.
Cool. That's awesome. In terms of, this is kind of in the last pieces of it, so feel free to drop in the last few questions as we'll be wrapping up. But Akhil, Rahul, as you have to go, and if you have to kind of go back to memory lane, look at your own applications, because oftentimes, there is this Reddit threads and kind of random stories of this crazy winners, but like those are not average profiles that we have seen, on a daily basis that we work with, right? If you were to reflect back on your application, what really worked for you? And if you had to go back in time, what would you change? Or what was the mistake that you made that you would, suggest that the others don't make?
Yeah, so looking back on my application, I think some of the things I wish I had done a little bit differently. That's a great question. I think that I think like having more well-rounded experiences, if that makes sense. So I had some research, I had some volunteering, I had some shadowing, but I don't think that necessarily any one of those categories was necessarily a forte of my application. I think that what the strengths of my application lied in being somewhat non-traditional. I was an economics major coming from Northwestern. I had this whole idea of going into finance or private equity or something along those lines out of college, because that's what a lot of people from my school go into. And then I kind of had this sudden shift my junior year. And so I think one of the strengths of my application was being this non-traditional type of applicant, because you don't necessarily want to be that biology major who did biological research, who shadowed a ton of people, because there's, especially with the number of applications there are nowadays, you're going to be one in there's going to be thousands of applicants like you. Find out in which ways your application is unique and really capitalize on those in the personal statement.
Yeah, I agree. I think for me, one of the things that definitely worked heavily in my favor was I had a few experiences that I think were very formative in my decision to apply to medical school. And I think I was really well able to vocalize how those would make me a great medical school candidate. And for me, it was my research background, my Spanish major and study abroad experience, and sort of that from a cultural standpoint, and then some of the volunteer work that I had done in the local community. And like, I always felt like that was a trifecta for like a good medical school application. But I think one of the things looking back on, and now, kind of on the other side and having applied to residency and fellowship, is that it's always helpful to really also think about that next step is what I want to do in 5 years, what do I want to do in 10 years? And not necessarily even just for the personal statement, but those are often questions that you'll get asked in interviews, and even for medical school interviews. And it's not necessarily something that you have to have a concrete answer for, but something that you should show that you've at least thought about, because once you end medical school, there's still a whole host of opportunities and a whole host of decisions that have to be made in terms of what do you really want to do with that degree? Do you want to be just a clinician? Do you want to combine that with research? Do you want to combine that with business? Do you want to combine that with, public policy? And if you have that kind of insight, that's one of those things that if you have sort of the more traditional medical school, sort of biology, chemistry major application, if you have thought about those sort of things, that's one of the things that you can do to sort of set yourself apart as I've really thought about what the next steps are and what I want my degree in medicine to be sort of an avenue to, not just looking at for the next 4 years that I want to get a degree in medicine.
That's very well said, both Rahul and Akhil. Thank you for that. I think just to kind of sum it up, and we have this quote internally within Inspira. We often kind of share it out, which is like there isn't any perfect profile. Honestly, like having like over the last 8-9 years, having supported candidates across like 270 plus programs we've gone in, there is no winning profile. There is no one who is like, oh, this is what works, this does not work, right? So like go back to the whiteboard, look at things that worked best for you, that you are most proud of, give your best shot, take it and kind of, position yourself out that way. Thinking about who else is going to do what is not in our hands. We cannot control 59,000 people's life. We can control our thing. So when you put that 500 words on personal statement, when you put those 15 best experiences of yours, ensure that you're putting the best foot forward, and then you kind of take it from there. So I think with that, we would love to wrap it up. I know there are a bunch of questions around like for folks who are looking to explore working with us for this cycle. We would love to, for the BMES candidates, we are offering a free 30-minute profile evaluation and consultation. So you can go on our website, inspiraadvantage.com, and free consultation, book a slot out there. We'll also be following up with our contact information after this. So in case, with the recording, with the presentation, with the other stuff, or in case someone would like to have more questions, feel free to schedule some time. We would love to kind of answer further on that. And then we have a little promo for folks who are kind of, applying this cycle, either on the MCAT or on the admissions process. Happy to kind of support in that way. But it's been a total pleasure for us to kind of be here, spend our time on here. And please, if there's anything else we could do, don't feel shy to kind of shoot us a note. I'll be more than happy to answer all your questions. Thank you, Ryan, for kind of facilitating this. Been a pleasure.